Hi everyone, welcome back to my channel. I'm back in Washington and it is so cold. I think it's like 40 degrees outside. Anyways, so I am back doing my rotation. I wanted to show you what typical family medicine is like in an outpatient clinic. I think my goal for my channel is not only to share with you the amazing aspects of medicine, but specifically family medicine, because that is the field of medicine that I am in. And of course, I want to show you like life-work balance and all that stuff. So hopefully it'll be an exciting day. All right, let's go. So it's currently a little past 5 and I'm finished with clinic, but I don't know if you can see, but it's totally dark outside. It's totally dark outside. I'm gonna turn on the heater because it's really cold. Actually, you guys probably can't see me, but I tripped and fell over the swing and twisted my ankle, and I like screamed like, ah! I was like so embarrassed. I was like, hope no one saw me. Anyways, I will get home and tell you more about my day because it's too cold right now. Wyatt. 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 Hello. Mommy's home. Mommy's home.
Pretty much all the time, non-stop. That's that. Me and my herbivore friends.
Hi.
Who's going all the way? This is really tough. I know. Find out on the Voice Kids semifinals. Saturday, 4:30.
Can mommy have some? Hey. Rude. You don't like to share with mommy.
Okay.
Now there's a little bit more right here. There you go. Hey. There's more. You want this one? All right, everyone. It is the next day now, and I was so tired last night that I fell asleep, so I just filmed a little bit of Wyatt and headed to bed. But I just wanted to sit down and talk to you guys more about the whole aspect of family medicine and why it is so amazing as a profession. And I think it's my job to help educate you all and hopefully influence some of you to pursue family practice or even consider it an option. I feel that our society nowadays are so subspecialized that it's what someone said this really well. It's like there's not enough quarterbacks for all these subspecialties, and I feel that as a family medicine doctor, I'm the quarterback. So let me explain why. I feel that when most people think about family medicine, they think, oh, I'm gonna go to my primary care doctor because I need a referral, you know, but that's not always the case. Just because you have a skin issue does not mean that I see you and I refer you to dermatology. Just because you're pregnant does not mean that I have to refer you right away to an OB, or just because you have diabetes does not mean I have to refer you to an endocrinologist. Just because you have more than 6 health issues does not mean I need to refer you to an internist. Just because you have depression does not mean I have to refer you to a psychiatrist. You know, I feel that as a family medicine, I am trained in all those things. That being said, you are only as good of a provider as your skills. So know your limitations. I know when I don't know something, you know, so like I see basal cell on someone's face, I'm going to refer them to a dermatologist. Maybe they need a Mohs procedure. Or if I see a pregnant mom and she has hypertension and gestational diabetes, she automatically becomes high risk. And so I'm not going to see her. I'm going to send her to an OB who is more equipped to see her safely. Or even pediatricians. I feel like nowadays, you ask any mom and you ask them, who is your pediatrician? Not who is providing your child pediatric care or who is providing you OB care, obstetric care, because I feel like family medicine, you can see children. You don't have to go to a pediatrician. So I think my goal is to change that, because I personally want to practice full spectrum medicine, and I want to see everyone, like children, babies, adults, teenagers, old geriatric people. I want to see everyone. And so I would hate to become a family medicine physician who only referred out. So to tell you a little bit of my day, anyway, so yesterday, I'll tell you a little bit about the type of patients I saw in my clinic. I saw a 36-week OB patient. So at 36 weeks, I did her regular prenatal stuff, like I did her GBS screening. She was actually complaining of some contractions, and she was concerned about vaginal bleeding and all that stuff. So we did an exam and pelvic exam and all that stuff, and we had a bedside ultrasound, which we used, and everything was okay. So I am doing her prenatal care, but because she is higher risk and because she's had a C-section in the past, we are actually sending her to an OB to have her C-section done. So those are things that you can totally do as a family medicine physician. My colleague actually did a circumcision in the clinic. So you don't necessarily have to go to a pediatrician. You can go to your family medicine doc if they're trained. You just have to find the right pediatrician, and not all pediatricians do circumcisions too. So I think the scope of practice always your scope of practice is obviously how much training you did in your residency. What other interesting things did I do? I had a younger teenager who had muscle tension that she was so tight that it caused her pain. And their studies have shown that you can either inject the muscle with a steroid and it causes the muscles to relax, or you can do dry needling and use acupuncture needles, and it causes the same effect. So this was actually the first time I did it, and she was agreeable, and it was so exciting because it worked. Actually, I think I still have some of the needles that I can show you. So this is what the needles look like. Maybe I can take one out. But they're just acupuncture needles, and it was amazing how it worked, because she was like, she came in with pain, and she's very skeptical because the first time she's just like, oh yeah, physical therapy didn't really help me, and the manipulation that you did helped me slightly, but now it's still there. It came back, and it was in the same spot that when I saw her last month. And then so, see, this is what the needle looks like. It's puny. So then I asked her, I was like, hey, can we try this? And she was agreeable, and like right after, she was just like, oh my gosh, it's gone, like the back pain is gone. So I was really excited that it worked for her. I'm gonna see her back in a month and see if it helped, and if she continued doing her stretches and exercises to see if her back pain returned. So that is pretty awesome. What else did I do? I did regular pap smears, screenings, well-woman visits. There's obviously the usual stuff, like hypertension, diabetes, but once in a while they throw in like a punch biopsy or a toenail removal or a laceration repair. I get actually a lot of OB patients in my continuity clinic, so that is very nice. But I do pap smears on a regular basis. I use OMT, osteopathic manipulative treatment, on a regular basis for back pain or people with fibromyalgia. What else do I do on a regular basis? I insert IUDs, do Nexplanons after prior authorization. All those things are on a regular basis. So, yeah, what questions do you guys have about family medicine? Like, what can I say to convince you to look into this field? Because I just think it is so amazing, and it allows you to connect with your patients on a much, not, I don't want to say that it's much more than other physicians, because I feel like every physician connects with their patient on such a deep level, and it's such a privilege to be able to share that vulnerability with your patients. But I feel like I get to share it with your whole family, and in different aspects of your life, like from childhood into adulthood, into birth, into, like all those things. Like, I feel so grateful to be able to be part of that. So I would love to hear what kind of questions you guys all have, and I would love to answer them. I hope this video was not all over the place, but it might be. Who knows? It's just a regular vlog. So on another note, I would also like to thank all of you for supporting me, supporting my family, supporting Wyatt especially. Like, the love you guys show him is ridiculous. Like, I feel like you guys love him just as much as I love him, and that is so special to me. Also, I think it's just, I've grown so much on this channel, and you guys have supported me through that. Like, obviously I know that, like, I'm not the same person I was in med school, and I feel like that's a good thing. We continue to grow each day into a better person, I feel like, and you guys were a part of that. I also feel that this is a space for freedom to express yourself, and I feel really grateful that a lot of you have told me when I'm wrong, or I'm glad that a lot of you have expressed your differences, basically. And at times I'm just like, yeah, I was wrong, or yeah, I feel like I should change this about myself. And so I really appreciate you shedding that light with me, and it's amazing to be able to mingle with people who have different views but still get along and like each other. And I feel like that's what my channel is about: growing experience. Like, I know I'm not perfect, and I don't think that anybody is, and so all we can do is try our best and help each other be the best person that we can be. And so I thank you guys for helping me to be a better person, and for all your support and all your love. And so I would love to give you guys something for that. Hopefully each video this month I will be doing a giveaway. So, babe, can you bring me those two? If you guys follow me for a long time, you guys know that I love makeup, and I used to wear a lot more makeup, but ever since I had Wyatt, I just don't have time. And so I thought to myself, if I can't enjoy it, then I want someone else to enjoy it for me. So I have this little Sephora lip sampler kit, and everything is nude, and I really wanted to try this, but I feel like this will be better off for someone else to try, and then you guys can send me pictures, or whoever gets this, send me pictures so I can see how they look on you. But that I thought was really cute. And then I bought this because this is like the Fenty lip gloss, and then it comes with a highlighter. I've never tried the highlighter before, but it looks gorgeous. And this lip gloss I freaking love. This is like my favorite lip gloss. It's like thick but not sticky. It just feels nice, and it just makes your lips look like glossy. I don't know, I can't explain it. It's so good. So To win these, you have to be, I'll leave everything in the description box, but obviously be subscribed to my channel and leave a comment down below of what video made you subscribe to my channel, or your favorite video that I've made. And I'll pick a winner in about a week. I'll announce it on my Instagram stories, so follow me on there as well. Thank you all, and I'm so excited. I'm so excited for December because I'm so excited to give away more gifts. And I'm doing inpatient medicine, pediatric inpatient medicine in December, so we'll see how that goes. I'm excited to show you more of the festivities that we're doing. Okay, this video is long enough. I'll see you guys next time. Peace.
What? Got distracted?